with the team from Wilf Ward Family Trust on co-production in action. We're going to be looking at what co-production means, how that's actually put into action day to day, and hearing from our fantastic panelists on that and more. Just by way of a brief introduction to Wilf Ward Family Trust, at Wilf Ward, co-production isn't just a concept. It's lived every day through groups like Jigsaw, where supported people come together to shape decisions, spark campaigns, and dream big about the future they want. From making sure daily records capture what truly matters to an individual, to giving people a direct voice with the Board of Trustees, Wilf Ward is proving that when people are genuinely included, the results are transformative. In this webinar, you'll hear from two of Wilf Ward's leaders in co-production, alongside a member of their Jigsaw Group, stories of change, challenge, and celebration from both staff and supported people's perspectives, what meaningful co-production looks like in everyday practice, and how it feels for the people involved, practical steps any care provider can take to start their journey, and honest reflections, inspiration, and plenty of ideas to take back to your service. So without further ado, I'm going to throw over to our panel to introduce themselves. If I could start with Louise Bowman.
Okay, yeah. So I'm Louise Bowman. I work for the Wilf Ward Family Trust. My role is I lead on active support and quality of life. We've been focusing on it in the trust for about the last 5 years. So.
Thanks, Louise.
Hello, I'm Louise Crampton and I lead on co-production and involvement for the organisation. Fairly new, we're just 2 years into it, so yeah, we're on a bit of an X Factor journey.
Fabulous, thanks.
I'm Stewart and I'm the part of Jigsaw and the IDD group.
Thanks, Stewart. Great to have you here with us.
Yeah.
So I wanted to start with a question to the whole panel, to everyone. What does co-production mean to you? When you hear that word, what does it look like or feel like in your everyday life and work?
It means equality to me, and it means valuing people and respecting people. Yeah. It means that the individuals we support have an equal say in what happens in our organisation. It's not just about inclusion or paying lip service. It's about hearing individuals' voices, really listening, but acting on what they say and tell us as well. And I feel it's about us learning from each other. It means we're really asking people what they think to what the trust does and listening to those answers. But it does also mean individuals co-produce their own lives and they decide on their own futures and direction, because co-production really begins at home and it begins with things like active support. So I'll pass over to Louise.
Yeah, I mean, I would agree with all of that. I think for us as an organisation, it's been about changing our habits. I think it's about changing the starting point. I think sometimes we've started from an organisational point of view and not from an individual point of view. So I think it's about changing habits and starting to really listen, you know, from the beginning, from the right places. So listening to the people that we're supporting and using the right language to make sure that we can hear and they can hear us, you know. So, yeah.
Brilliant.
Well, just listen and do it.
Yeah, listening and doing it.
Yes.
Absolutely, so important. And I couldn't agree more, Louise, that the importance of terminology and language in co-production is vital as well. Yeah, thanks so much, everyone. And to the Louises, I had a question. How did we begin on weaving co-production into your daily practice? What were some of those first steps? Because I know you mentioned it's a journey you've been on over the last number of years.
For me, I spent a long time wondering where to begin with this. This was a new role. So I talked to a lot of other people in other organisations who were already on that co-production path, and working together with the people they supported. I kind of got myself invited to other people's groups or meetings and observed what they were doing and took things away from that. I read a lot about what good and bad co-production was as well. And I started to make links with people who I thought were doing a great job, and what could I learn from them. I also, in our organisation, started talking to people we support and to staff teams about what co-production meant. And we really looked at things like, excuse me, the ladder of co-production, and looking at where we were on that ladder and how could we climb that ladder more. What were the practical things we could do to climb that ladder? And started building up those relationships of trust with people as well, so that we could start sort of pulling groups together if we needed to, or talking to people about how they felt. And I started really with a small group of people and asked really direct questions about what they thought we were doing with recruitment. How could we improve our recruitment process? And I was just absolutely blown away by the answers that we got from that group. By asking those really direct questions, got really direct answers back as well. And there were times that we sat back in that group and went, wow, why haven't we thought of that? So, you know, they had a real impact, that first small group, on our recruitment process and the changes that we made to that. So, yeah, that was a real sort of buzz and a real eye-opener that if you ask people, they will tell you. And I don't think we've done enough of that in the past.
I think the only thing I would add, I mean, Lou's done an amazing job with this. I think the only other thing I would add was that when we first started active support, we designed some active support training, and it was everybody in the organisation had to complete the training. So our trustees, our CEO, all of our support services, our finance teams, our recruitment teams, and then all of our frontline staff. And we've woven all of those co-production principles throughout that training that we deliver, and people have to do that training every 2 years. So we're constantly upskilling people and reminding people and generating conversations about co-production. And I think for the organisation that's been really important, because co-production takes longer. It's not something that you can do quickly. You know, if you're genuinely going about in a co-produced way, then we have to give people longer. So I think we've really tried to build that whole ethos throughout the whole organisation with the training that we deliver.
Mm. Yeah, that's really, really important. I can see how that would have had a big impact on the co-production that you guys are able to actually bring day to day. We've heard about some steps that you've taken there in terms of training, in terms of getting groups together to listen to them. What are the more everyday steps, the small but powerful steps that you're taking to ensure people's voices are really reflected in their day-to-day support?
So I think when we first started the active support journey, because that's been going a little bit longer than the co-production work that we're doing, we recognised that a lot of our culture had elements of the hotel model built, you know, in it. We were quite task focused in some services in the way that we supported people. So we made sure that everybody was really well cared for, really well supported, that they were safe. But we weren't paying enough attention to quality of life and really listening and empowering people. So the training we designed really had to start to change that whole focus, our whole culture, the way that we actually approach that support. So we had quite a lot of learning to do in the very early stages to really make sure that we built in listening to people's voices and making sure people were included. And one of the ways that we did that was I designed a tool, and we just called it a pathway to independence, for want of a better word, which was a kind of visual tool that used a series of conversation cards to involve people using a kind of talking mats approach. And we used it right across the spectrum of ability. So we used it with people that were in our transition services that were looking for a very quick piece of support in it to enable them to move into their own homes, but also right through the spectrum to people that had very profound and complex learning disabilities, to also give them a voice in their own support. And it really became a kind of strength-based approach. So it helped people really look at what they could do and what they wanted to do and what their aspirations and ambitions were. And then all of that work that came out of that was the tool that we used to set people's goals and design the way that we supported them. And that then informed all of the support plans. So it made sure that the support plans actually had the person's voice in them, and that their needs and preferences and wishes and aspirations were all threaded through that. So, and that's been a really powerful tool that we still use. We still use that. Lou and I are part of a quality team. So the Wilf Ward Family Trust has a quality team. And our role is to kind of support staff, but also to kind of challenge and motivate and disrupt. So we do that quite a lot. We go in and we support people face to face, and we kind of we ask questions, and all of the tools that we use are kind of, they have built into them the active support and co-production quality of life principles. So the measurements that we do, we don't only measure compliance, you know, that we've done all the health and safety checks and that we've done the food hygiene work, but actually we've included things that are important to the individuals, and we really look at all of those domains of quality of life. So all of our tools, all of our auditing tools have all of those mechanisms threaded through them. As I said before, language is really important, and I think, Lou, particularly, we've been on a bit of a campaign to change our organisational language. So we discovered that a lot of our language was not accessible to everybody. We're an organisation that likes an abbreviation. So I think we had about 3 pages of abbreviations, you know, that we use. We use a lot of jargon. And when we looked at our language, it was exclusive. It was excluding people from conversations, because either you were in the conversation because you could understand it, or you weren't. So actually, we've had to really break down that. Luke calls it language of power. You know, we really had to break that down so that everybody can understand and can be included and participate in those conversations. So that right through. So that goes right through all of our policies. It goes right through all of our training modules. It goes through all of our recruitment tools. It goes through all of our induction. So we're really focusing on language to make sure that everybody's included in that process.
I've just asked Stewart what we've done practically to try and stop the language that we have in groups, the complicated language. What do we do?
Busters.
We have jargon buzzers.
Jargon buzzers.
So we all have a buzzer on the table, and if we hear a complicated word, what do we do?
British do that.
Yeah, and we try and find another word that is better and includes everybody.
Yes.
Great, thank you, Stewart. Thank you. And the last thing that we've done is we've had a look at where we felt that we weren't getting it right. So we had a look at 2 examples where we felt that quality wasn't good enough. And one of those was about when people went into hospital, and one of those was about the support that people received around their epilepsy treatment and support. And we've just done a couple of studies to really listen to the people's experiences and work with people to try and change those experiences people have into a more positive experience. So we've done loads of kind of really practical stuff. There are a few of the snapshots of the things that we've done. I don't know whether Lou and Stewart have anything to add.
No, I don't think so.
Really comprehensive. Thanks, Louise. It sounds like you've been on a real journey with this, involving some deep reflection and some real positive outcomes and actions from those tools that you mentioned that are having real impacts for people day to day. It's great to hear. Wanted to move on to some less positive things, perhaps, or there are chances for positives. So, you know, any challenges perhaps that you have seen and the lessons you've learned from those challenges to overcome the barriers. So I think from what you've described there in the process, co-production isn't always easy. What kind of challenges have you faced and how have you worked through them? You know, one being the buzzers. That sounds fantastic. We could do with some of those at Log My Care, I think, ourselves.
We have them in senior meetings as well. The buzzers come in.
Really?
You know, it's right from the top that we
Yeah,
try cut down, don't we?
Yeah.
So I think communication and getting people involved was one of, and still is one of my biggest challenges. Once people are involved, there's a real commitment to it, and people come back again and again to different groups that we have. But trying to reach everybody to find out whether they want to be involved is sometimes quite difficult. And we've resorted to things like, you know, posted letters that go directly to individuals, because we've got 80 services over quite a wide geographical area. So trying to reach everybody has been a challenge and still is a challenge. But we will keep on going until we find the right way of doing things. I think the other thing to acknowledge is that not everybody wants to be involved either. And we kind of might sometimes assume that everyone might want to tell us what they think about things, but some people don't. But we'll keep talking to those people because at some point they might find something they feel really passionate about and want to tell us about that. I think quite often people aren't used to being asked what they think about something. So it's taken a bit of time for people to feel really confident to be able to tell us exactly what they think. We found that there was a difference as well with our Jigsaw Group. You have people who support you there as well, don't you?
Yes.
Whereas our Equal Voices Group, who are linked to the Board of Trustees, they have no staff support with them. And we saw a real difference in how people responded without staff there. So that's something else that we're going to look at as well. Conversation was much freer when support staff weren't there for whatever reason. It's also about thinking and doing things in a different way and making sure that people are involved right at the very beginning of something. And I know Louise said that sometimes we have to be disruptive and challenge. And there's been times where I've had to really challenge when somebody's come to me and said, can we get a group together because I want to do this? And I've already got a preconceived idea of what they want to achieve at the end of it. And I've had to go back and say, no, co-production means that we go in with no preconceived ideas about what we're going to get at the end of it. So that challenge really is important to make sure that we do co-production properly.
Absolutely.
I think the only thing I would add is we had quite a lot of unlearning to do. We had a lot of unlearning. We had to build that in as our first step, really, both individually but also as an organisation. We had to completely unlearn the ways that we had done things and try and find different ways to do things. And I think, as Lou said, one of the big risks was that kind of tokenism, that actually it ticked the box that we've asked the individuals we support what they think, but actually it was a tokenistic gesture. And I think if we're doing this properly, then we really need to make sure that it isn't, just looking good on a piece of paper, that actually it's meaningful and real, and people's values and views and comments have equity, and are not just done because it looks good. So I think that's a risk we've been very aware of, I think, as we've gone through it.
Yeah, I can absolutely see that. If you're taking that step back from the kind of task-led tick box approach, then it has to extend to the entire way that you approach everything. Yeah. Stewart, sorry, were you going to add something there?
No? I'm all right.
Okay.
No challenges, awesome. Well, this one, again, for everyone on the panel, it was about, we've talked a lot about groups so far today, but I was interested to understand, how do you make sure to keep things personal and meaningful for each individual whilst you're supporting so many people at the same time?
Yeah, so we support nearly 300 people. We've got nearly 800 staff, so we are a big beast. To make it very person-centred, you've got to work hard at it. When I started the active support role, when I looked at how we were involving people and making things person-centred, particularly in our documentation, the way that we were doing it was we were giving people a blank piece of paper or a blank diary. I'm sure you remember this, Stewart, and we would say to the staff team, just tell us about the support that you've delivered today. And sometimes we got things like, oh yeah, all fine today, no issues today. And then the other thing we would get pages and pages and pages of documentation.
Yes.
But it just wasn't person specific, it wasn't person centered. And I think staff teams, what they were doing was they were writing what we thought they wanted to write, and there was this kind of thing that if we didn't write it down, it didn't happen, so there was the quality of our documentation was needed to improve, I felt. So one of the things that I started to do very early on was we worked with individuals and their support teams to really design their own piece of support guidance. So everybody has an active support co-production logbook, or they had until we went to Log My Care. And in the back of that was a very bespoke piece of support guidance. So it sits alongside the support plan, but it gave the support teams a really clear direction about what we wanted them to capture. So if it was it was those things about what's important to the individual and what's important for the individual, and it needs to capture both elements. And I think what we were capturing a lot of was what's important for them. So it's important that people have a healthy diet, and but actually what we weren't capturing was what was important to the individual. So we made sure we threaded all of that through, and also making sure that we recognised the person's voice. So actually we could offer things, but if they decided not to do it, that was fine. We still offered it, but actually they had the option to say thanks, but no thanks, and that was no reflection on our support. So so I think that very unique and tailored piece of guidance made sure that actually it was very meaningful and very purposeful. And also if we'd offered things like advice and guidance, so we could remind people, remember the doctor said that to you, so actually this is why we're advising you to do this, and we could capture that a little bit better. But it also helped inform the individual about why we were advising and guiding a piece of support, so and it really focused our team's minds on why are we doing it, and how are we doing it, and what's important to that person as well, rather than just capturing those very task-based things. They've had a shower, they've cleaned their teeth, they've had breakfast, they've had lunch, all those kind of things. That's how our documentation was, and it didn't tell us anything about the individual and how they felt about their support that day. So everybody now has one of those, and that's how we're trying to figure out now, how do we migrate that into the Log My Care tool. So I think that's where we're at in the journey at the moment. My role then is also to make sure that I work with every individual manager in every service to make sure that actually all of that continues, that really person-centred approach, that we don't go back to that kind of ticking boxes, that somebody's, been to the toilet or brushed their teeth or whatever it is, it needs to carry on. So it's hard work, but that work carries on.
Thanks so much, Louise. And Lou and Stuart, did either of you guys have anything to add on where and how you ensure that records feel personal and meaningful to each individual?
So are you involved in writing your own records every day?
Not yet.
Not yet. You will be with Log My Care.
Yes.
Yeah. Okay.
Brilliant. Yeah, very soon, I'm sure.
Yeah.
Yes.
I wanted to, last one on the negatives, I promise, before we move on. Can you share an instance or an example of a time when co-production hasn't gone quite as planned, and then what you learned from that and applied going forward?
I think we've got lots of examples where we could do better, and we're just learning all the time. I think one of the things that we found fairly quickly was that we didn't use the term meeting, we used the term group. Meetings seem to have a negative connotation for a lot of people. Yeah. So that was one of the first things we did once. It's Jigsaw Group, Equal Voices groups. I think sometimes with the best planning in the world, we can get it wrong. We've been doing a lot of work on everyday citizenship, and that is being led by two of the people we support. And we recently had a meeting with them, and I don't know, it might have been the wrong day, it might have been the wrong time. I feel that my questions were too vague. We've done a lot of work on what have we done in the past, and then I asked quite a vague question about what can we do now, and I think that was probably the wrong approach to take with those two people. So we constantly do plan, do and review in every meeting so that we're learning all the time from what's happened. One thing that you could think goes wrong, but actually turns out right, is we'll quite often go off topic, don't we? Yeah. We start off talking about one thing, and then it leads on to something else, and it leads on to something else. And quite often we get brilliant ideas and suggestions and conversations from those. We can pull it back to what we're originally talking about, but I don't worry so much anymore about us going off topic a bit. If we've given ourselves enough time, we have good chats, don't we?
Yeah, we do.
Yeah. I think one of the other things that didn't go as planned was setting up our Equal Voices group, which is the group that has a direct link to our Board of Trustees. And it was quite a battle to get our Board of Trustees to understand that they would need to change the way that they did things, rather than our group of individuals coming in and having to understand everything that they were saying. They speak in a completely different language to you and I. The meetings are sometimes held in quite intimidating rooms. They're very, very structured meetings, and yeah, it took a while to get the Board of Trustees to understand that they would need to change the way that they did things to make sure that everybody was included. But that group actually has turned out to be brilliant. Our Equal Voices group are the group that are asking really probing and challenging questions about why does the trust do things this way? Why aren't you giving us information on this? And they're really pushing the Board of Trustees as well. So that's been, something that started off being quite challenging, but has turned out really well.
Yeah, that's fantastic to hear. It sounds as though, agendas we all know can be useful, but ultimately you need to meet people where they're at in the moment.
Yeah, absolutely. Yeah.
I've nothing to add.
Well, I wanted to move on to involving the people that you support, the individuals themselves, and getting a bit of a personal perspective from Stewart. What has it been like for you to be involved in the Jigsaw Group and other decision making, and what difference has it made to you personally?
Very good.
Yeah. Stewart's made some notes. So
it has been very good. We ask people lots of questions. We think about things what are going on at the minutes, and we put notes on walls, and we asking questions. Last time we told the leadership team when should do it really want to come us to visit us.
So yeah, the leadership team want to call in and visit people and check that everything's okay, but Jigsaw wanted them to do things in a certain way, so you told them how you wanted them to do it, didn't you?
Yes. We talk about what we like going and what our big dream. We have made 2 videos about mental health and is what Lord my care. We should share what we have been doing with other people. I am a part of EDI group, and at the last meeting we told the leaders how we feel about together some new managers. It was very good to listen. I could what was going on. It turned then to what it can be better for everyone next time.
So we had some changes, didn't we, in our organisation?
Yes.
So different managers. So
Yes.
they asked us what we thought about how they'd done things, how the senior leadership team had done things. So you were very clear, weren't you, that you hadn't felt like you hadn't been told everything at the right time. So that makes it better for the next time.
Yes.
Yeah, it's great to hear that your voices are shaping the entire organisation, the decisions that you make. Next one was for the whole panel. It's about representation in action. How do groups like Jigsaw and Equal Voices make sure that the ideas of supported people are shaping Wilf Ward and what the trust does going forward?
Shall I start?
Yes.
So in Jigsaw, we've looked at things like the rotas, because it seemed that everybody had a different way of presenting the rotas. And people didn't understand all of them, did they? So we looked at a way that was better for everybody to understand the rotas. So our HR team took that away to work on. We have a policy group, so they've helped us review our holiday policy, our visit policy, and they're looking at our values in practice. And like I said before, we've also been looking at everyday citizenship. So we felt, and the group of people in Jigsaw were very clear that we'd done a lot of, this is what we can do for you, rather than actually, what do you want from us? So we're turning that balance of power around for our individuals to say, this is what we expect from you. We have Equal Voices who are really challenging the way that we do things. And Stewart, you said that, what did you do for Log My Care to make sure that everybody knew about Log My Care?
That's video.
So you made a video that we've shared with everybody.
Yes.
And we did a cartoon strip as well, didn't we, for other people that told them about Log My Care too.
That's right.
Do you want to talk about dreaming big and what dreaming big is?
Dreaming big means people ask everybody to pick what the dream is, and that's what they want to do.
So yeah, we have part of our support plan that is about dreams, wishes and ambitions.
Yes.
We wanted everybody to have the same sort of dreams, wishes and ambitions as you and I have. So we shared our ambitions and dreams, didn't we? Our big dreams, and people took them away. We shared it with everybody in the organisation to make sure that everybody had those in their support plan so that we weren't missing anything. So yeah, and lots of people have been working towards their big dreams that we share with everyone, don't we?
Yeah, we do.
Yeah, people going off on cruises and doing all sorts of great things. At the end of Jigsaw and our other groups, we always ask the question, what does everyone need to know about this, and how do we get that message across? So I think there always has to be something that comes out of our groups, doesn't it? So we're not just talking about it, there's an action at the end of it, and we can follow up those actions at our next group, or we can develop an easy read or a video or something like that to make sure that things are really meaningful as well.
Yes.
Brilliant. Thanks so much for sharing. I just wanted to move on to what the future of co-production could look like, because we've talked a lot about the journey you've been on over last years, and lots of new tactics and techniques have emerged over the last years, as you guys have elaborated on today. But looking ahead, what do you want to see as the future of co-production over, say, the next 5 years?
I'm reading and agreeing that innovation and co-production go hand in hand. I mean, we learned really early on that when you ask people direct questions, you get amazing answers, things that we'd never thought about before. So it is about that innovation. And it's not just a nice to have anymore. It's essential to getting things right from the very beginning, and to really hear what people are saying. It is turning around that balance of power from what we think should happen to what people actually want from us. And I think the other thing that I'd really like to see is more people who we support going on that path to being a trustee and having a real powerful voice in the organisation right from a very top level.
I think the other things I would add, I think we're really excited about the new digital platforms and the opportunities that brings. I think that will help, like you said, Stewart, maybe being a bit more involved in your your notes and your support plans. I think that's going to be really exciting. I think we've also got some plans in terms of people becoming quality checkers. So actually, training some of the individuals that we support to actually get involved with leading on some of these things. And actually, I think that's a really exciting opportunity as well. And I think things like the citizenship, the 7 keys, that's going to be a big focus for us over the next few years as well. So making sure that people step into that citizenship role, I think that's going to be something that we're going to be working towards. And I think a big one for me is we still have a lot of people that still live in learning disability land. They go to learning disability services, and they don't belong in their community in a really meaningful way. So I think for me, with my Active Support hat on, I think it's about really finding ways that people can belong in their own communities and have a voice in their own communities and have that true citizenship. So I think that's something that I would like to see us step more into in the next few years. So.
Sounds like a really exciting future ahead with lots of possibilities. Just as we wrap up, I wanted to get your advice for others, for the providers that are with us today listening. What's one kind of simple, actionable piece of advice, one step that they could take from tomorrow to start putting co-production into action and making it stronger in their own services?
I think if I had to pick one, I'd say look at where your starting point is, because your starting point should be with the people that you're supporting. If it matters to them, they should be involved. So I think it's not assuming that we know what is best for people, that actually we genuinely stop and listen to people and actually let those people influence decisions and processes and all of those things that we have to do as organisations. So I think it would be check where your starting point is and make sure you're starting in the right place.
I think my bit of advice would probably be just do it. Start asking those questions, ask direct questions of people. Start to make the changes that make your organisation more accessible to people you support. Start thinking about the language that you use. Really reflect on all of the jargon and abbreviations that we use in social care that really exclude people we support. Ask the questions. It will start a movement. You'll find that people want to be involved then. You'll get people coming back and they want to continue being involved in those conversations. And people feel valued, and you see people's self-esteem rise as well. So, yeah.
And I think just be brave and have aspiration. Yeah. I think that's such an important thing, isn't it? To have aspiration and be brave in going forwards to help people achieve those aspirations. So, yeah.
Anything to add, Stewart?
No.
Brilliant. Well, thank you all so much. We had a couple of quick questions from the chat before we wrapped up. So I'll just throw these out and feel free to jump on them as they come. Someone asked, what is the ladder of co-production?
If you Google the ladder of co-production, it's a really useful tool. So it is a ladder. So at the bottom, you've maybe got coercion, and at the top, you've got people being in control, and it's all the steps in between. So it's a really good tool to evaluate where you are, either in a service or an organisation.
And we use it in our training, don't we? So we give scenarios and we ask teams to think about where is that practice on that ladder of co-production, because sometimes you think it's at the top, but actually it's maybe a little bit further down. So it's a good training tool, isn't it? So.
Brilliant. I know we have some content on that as well. One of the chapters in our latest ebook, which our team will share afterwards. So yeah, you can have a close look at it there as well.
Great.
Jenny had also asked here that they'd love to know a little bit more about the Pathway to Independence tool and the conversation cards that you use.
It's a homemade tool, so it's just something that I've designed over the years. So we look at all the elements of support. So we look at all of the elements of personal care. So, for example, we might have a picture of a washing machine, and that's the conversation card. So we trace all of the steps in terms of gathering the laundry, all of those steps right through the laundry process, and we use that as a conversation card to say, which bits do you do? Which bits do your team support you with? Are there any bits that that you're not doing yourself that you could do yourself. And so sometimes it's things like, well, actually I don't know where to turn the dial round to on the washing machine, so actually if I put it on that dot we can turn it round. So there's very practical things like that, but there might also be tools about what are your hobbies and interests, and where can you find that in your community, you know. So it tries to encompass all of those aspects of support that we use. And we have a picture tool. I use the easy on the eye symbols, and we just lay the cards out and people can select which bits they want to speak about. But it's it kind of focuses on the practical elements of support, but also the aspirational elements of people's quality of life and well-being as well. And we see where the conversation goes. And then each one, so we have a red card, an orange card and a green card, so they would lay it on the card. So green would be I'm really happy with this, it's in the right place for me. Amber might be, actually there's something I need to do, or some support I need to get it onto the green card. And the red card would be, actually I'm not started on this yet, I'm really unhappy about this. And it then informs a set of actions and goals from that conversation. So hopefully in a nutshell that gives you a bit more of a picture what it is.
Yeah, that's absolutely brilliant. Thanks, Louise. And the last one to finish up, one of our viewers has asked, can Stewart tell us about his big dream that he's working towards at the moment?
Big dream.
Volunteer to be in videos.
In the videos?
No, the video. The YMCA.
Oh, the YMCA. Tell us what you do at the YMCA.
I do tickets, print tickets, you know, with
With a stamp.
yeah.
Clipper, yeah.
And then do her screen, sell her screen.
So you achieved your big dream.
Yeah.
So we'll have to think of another one. You had another one, didn't you? You had
The football.
the football, yeah. So what did you do with the football?
Well, it was too cold. But you're gonna walk down and wait for people, see when not get bad people about.
Yeah. So you worked at Scarborough Football Club, didn't you, for a little
Yes.
while? But it was too cold, and sometimes your big dream doesn't turn out quite as you want it to,
No.
does it? So we get another one.
Yeah. No, I can see that. But yeah, it sounds like you had a fantastic time at the theatre, and hopefully when the weather's better, maybe back to football again.
Yeah, we'll see.
Well, so yeah, just to wrap up, someone had asked in the questions here whether co-production is part of the demo with Log My Care and part of the platform. It is, thankfully, and these are a couple of quick examples that we just wanted to flag up to you. So we've been talking about dreaming big, and our goals and outcomes feature really links into that. So you're able to log and record and sync all of those records to goals that people are looking to achieve. Individuals can add their e-signature and also add comments to those goals as well. We're also able to change the perspective of logs with one tap. So supported people can be next to the carer, enabler, support worker that's supporting them, and they could record the log together. With one tap, it's written from the first perspective, the first person, rather than by the support worker about the individual being supported. And then finally, there is the ability for support workers to review documentation within the Log My Care carer app. So with, obviously not everyone can do that. You'd have to give the permission to an individual for them to be able to do that, but they could review and unlock the document. And then again, sat directly next to the person that's being supported, additions, changes can be made via voice dictation by that individual. So these are just a couple of the areas that we have at the moment within the platform, with many, many more planned going forward. And very, very last thing, thank you so much once again to our fantastic panelists from Wilf Ward. It's been an absolute pleasure hearing from you all about co-production. And I know that I, for one, feel like I've learned a lot from today and taken a lot away.
Yes. I did as well.
Thank you.
Thank you.
Yeah.
Thanks, everyone. Take care. Bye.
Bye.